Welcome, this is Workout Master, episode number 21. This is Ruben.
This is Aram.
And guys, thank you very much for watching our episodes. I'm getting so many good comments. I truly appreciate it. I'm sure Ruben does too.
So do I.
Today we have a great episode for you today. Ultimately, there's a lot of people have low back pain. And
millions.
And Ruben and I basically specialize in the rehabilitation of back pain. We rehabilitated a lot of athletes, doctors, just regular lay people. Ultimately, we have our own approach that we want to discuss. You know,
Absolutely. And the first question that we would like to ask our viewers is how this pain came about. Was it due to an accident, trauma, or it just showed up in your life out of nowhere, quote unquote? So it's important to realize which has been the object or the cause of the pain that you're having right now.
So there's a few reasons why somebody might have a back pain.
There's multiple reasons.
Multiple reasons. So we would want to figure out why is it happening.
Right.
The first reason, somebody might be born with some sort of deformity. Yeah, something like either scoliosis or developed over the childhood. Yeah, that's one of the reasons.
In the teenage years, when the people are growing up, they suffer from scoliosis there, or they begin to set in.
Okay. What else? Somebody can have like a serious trauma.
Car accidents, work accidents, slip and falls, playing sports.
Probably most common one that I've seen is a continuous low-grade stress or some sort of postural related issue.
Right.
Yeah.
Like a repetitive overload pattern.
So if you sit all day long and you tend to slouch, or you drive a car in some very unfortunate position. Anything low grade that is going to change your posture has an ability to create some sort of low back pain. We'll talk a little bit about it.
Mm-hmm.
What other things?
There's emotional issues that cause pain.
There you go. It's a big topic.
Yeah.
Big topic, and it's not necessarily widely connected.
Right.
Yeah, nobody connects your emotional issues with the back pain, but they are connected.
They sure are.
Another big one is the dehydration. So
Absolutely.
People don't drink enough water. We talked about in our episode about water, how important it is to drink enough water.
Okay.
What else?
And there's also, what's known as visceral somato, reflex. When you have an issue with an organ or a system of organs, and how they can affect, the muscular system. And if you want, we can actually give some information about each of them and how it can cause, pain.
Sure. Let's go. Let's talk about what is our approach, because ultimately people have a back pain, they want to get rid of it.
Right.
Yeah?
Of course.
What I found over the years that most of the time when you guys want to get rid of back pain, we generally run to the doctor. I mean, I was number one. I had a back pain for years, about 80 years of low-grade pain, including a groin injury that I had from soccer. And I went to the doctor. And unfortunately, when you come in the medical profession, and the way that they deal with the back pain, there's basically two strategies. One is medication. So if you're in pain, there's a pill. You take the pill, you feel better.
Right.
For some time until you feel bad again. Another approach is a surgery.
Correct.
Now, some people do need surgery.
Absolutely. There's cases where the spine is being so badly damaged, or the pre-existing conditions are so precarious that the surgery is the only and the last resource that you should use.
Exactly. So there is a surgery approach, there's a medication approach. Unfortunately, within the medical industry, there's not a whole lot of approach to corrective exercise, correcting somebody's posture and creating all. So part of it, that's where we come in as a corrective exercise specialist, and we'll talk a little bit about how we can help somebody who is not ready to have surgery or is not as bad yet to have a surgery, and hopefully we can rehabilitate him.
Right.
But on top of it, just besides that, even for people that have a back pain, there's a people that have a possibility of having back pain. It's important to prehab rather than rehab also.
Right. Absolutely.
And then our approach works for prehab as well.
Well, yeah, since you take care of the core issue, and the stability of the spine, it's pretty self-explanatory. If you have a strong structure, this lays it is less likely that you'll have an injury, a lesion, unless it's a trauma-induced, of course, an accident. And at the same time, any other factors that can contribute to the pain will be diminished because the structure that is being supported is so strong that the chances of injury by means of overload patterns, by means of digestives, we talk about the somatovisual or the visceral somatoreflex, it's not going to be an issue.
Mm-hmm. So our approach is to create a good foundation. It's like if an architect builds a building, he wants to create a good enough foundation for a certain structure. So we would want to see where our clients are at physically, where they want to be, and in many cases the reason why they have a back pain because there's a disconnect.
Right.
Between what kind of workload they put on themselves and what their body can take. Okay? So our job as a corrective exercise specialist is to create a good foundation. Let's talk about foundation.
Right.
Now ultimately, there is a spine, yeah, and it is very flexible.
It is.
It is flexible for a reason, and the reason is we are humans.
We need to move.
We need to move. That helped us survive. Now, as I always say, just because you have a flexible spine, whoever created us did not create a faulty design.
By no means. He didn't screw up in the making.
Yeah, so we are created by somebody who is extremely, extremely smart, by far smarter than us. And it's almost impossible to even understand how you can create the faulty design like that.
Well,
so
as far as the basis of engineering of the human spine, it surpasses anything that we have ever built, or that we'll ever build for that matter. Putting architecture and electronics and all together, it will never amount to the complexity and the functionality and simplicity at the same time that is complex of the human spine.
So think of it like this. Your spine is very flexible. It's designed to move in any kind of direction.
Correct.
Yeah? Now, since it's flexible, it is probably very easy to break.
It is very easy to take it apart. Perhaps not to break because the vertebral bodies, they're fairly strong.
Okay, so take it apart.
Take it apart. And actually, I can't recall exactly what I read recently, that it would only take about probably less than half a pound of pressure on the spine if all the musculature and all the ligaments were taken out of it. So by itself, it's not a strong structure.
Yes. Yeah. So ultimately, your spinal column is not designed for weight bearing, really.
Yes, that's a pretty kind of difficult statement to say yes or no to because there's many factors to influence it. But yeah, the design
it's
that
not
it
a weight bearing column.
Right, it's not a column. Because
Right,
you've never seen a
totally.
column that has an S shape.
Exactly.
Right.
So there's something supposed to support your back.
Yes.
So our approach is to create what's called a very functional core musculature that support the spine.
Correct.
Yeah? And the way I explain it is like this. So you have a spine, it's very flexible, it can move in any particular direction. Now something has to support this spine so it will not break.
Correct.
So your body has this mechanism, and we call it intra-abdominal pressure mechanism,
Right.
which is designed to create the very strong joint out of this very flexible joint. And the way it works, you have 3 layers of your abdominal musculature. One called is transversus abdominalis, then you have your obliques.
Which is the deepest,
From deepest to
more superficial.
yes. So you have your transversus abdominalis, obliques, then you have rectus abdominis. And all this muscle have to co-contract together. When you take your belly button, guys, just take your belly button and draw it in as hard as you can without moving anything but the belly.
Right.
So when you draw your belly button in, you're supposed to, body mechanically supposed to co-contract your deep abdominal wall, your pelvis muscles, deep pelvic floor muscles,
Pelvic floor muscles.
your multifidine muscles of your back, and your diaphragm. So think of it like it's like a cylinder. Cylinder, yeah?
Yes.
It's a better.
Yeah.
Cylinder gets contracted around your spine. And when this cylinder gets contracted around the spine, it creates a lot of pressure.
That's right.
And by cross section, your midsection becomes the biggest joint in your body. It's bigger than your thigh, bigger than your arm, bigger than anything really. So what you end up having very